So now let's transition to seizure safety. This is one of the most important parts that you will play as being a delegated care aide. Because we don't know when and where a student will have a seizure, it is so important for everyone to be trained in seizure first aid. The first course of action is going to be having the seizure action plan. This is something that is going to be provided to you. All of the information is available on the form, such as the seizure type, the length, the frequency, what are you looking for. There's some basic first aid information, as well as what the student is taking in terms of medication. It's likely that you will not be administering any medication. Most anti-seizure meds are given in the morning and again at night, but just so you have an idea, let's say, of what side effects or something that you might have to look out for. Another thing that we highly recommend at the foundation is that students wear medical ID bracelets or necklaces, and that is something that the Epilepsy Foundation of Greater Chicago can also provide for free to your students. So let's dive into first aid. So I know this is a little bit hard to do it this way, but if you can imagine a student having a convulsive seizure in the classroom, the first thing I want you to do is to actually stay calm and have someone go get the nurse, go get anyone else to help you. You're going to stay with the person and watch the time. That is the most critical thing you can do, is watch the time. It's the first thing EMS is going to ask you: when did the seizure start? Physically, if a person is having a convulsive seizure, you will turn the person onto either side, imagining that they have fallen to the ground. If they haven't completely made it to the ground, please do help them to the ground. It is the safest space for them to have a convulsive seizure. Turn them to the side. If they're wearing glasses, you can remove them. If they're wearing anything around their neck or on their head that you think could constrict them, go ahead and loosen that out. And then you're going to let them have the seizure, and you are not going to interfere with anything, because there's nothing that you and I can do at that moment to stop that seizure. So we're going to let them have the seizure in the safest way possible. If there's nothing soft nearby to support their head, go ahead and put your hand under their head. And then you're going to stay with that person until they are awake and alert and they know they just had a seizure. And that's when the baseline period begins. If you're working with a student who's having a convulsive seizure in a wheelchair, here, again, stay calm, call for help. You're actually not going to remove the person from the chair unless you absolutely have to, and chances are you probably will not need to. Here you're going to fasten the seatbelt and lock the wheels so that there is not a lot of movement, and then you're going to support their head as much as possible to allow them to breathe easily. And then when they are done with that seizure, you can allow them to have that post-ictal phase and rest accordingly, hopefully somewhere else on a cot nearby. For first aid on a bus or a train, knowing that a lot of our students do take public transportation, we know that the CTA designates the first train car as for anyone who has any sort of disability or any sort of need. So let's make sure that we are instructing our students to take that first car. As far as the bus driver, we definitely encourage the routes to be designed such that any student who needs assistance with a certain type of seizure should be picked up last and dropped off first. But let's say a seizure does occur on the school bus, which of course it can happen at any time. We would request the bus driver to pull over and allow that student to have the seizure hopefully safely in the aisle if possible, or on the bench seat if that is something that is also possible. The bus driver should also have a copy of the seizure action plan. So I know I mentioned medical emergencies beyond the 5 minutes. So in general, if a person does have epilepsy, they will have a seizure, and that is not an emergency. It's the lack of first aid that creates that emergency situation. So there's not always a need to call 911, but we are talking in the school setting, so you will need to call 911 whenever a student has a seizure. But that is not to add any sort of anxiety to the situation. You are doing that because lots of times we don't know if a seizure is going to go beyond 5 minutes or not. So we want to make sure that we cover our bases, but just I want you to know that not all seizures are going to be medical emergencies. It will tell you on the seizure action plan at what minute you need to call 911. And there are going to be some times that you always have to call no matter what, even if it was a 1-minute seizure. But if a student was injured, like if they hit their head somewhere along the way, if they had more than usual number of seizures, obviously if it went beyond 5 minutes, if a seizure happened to be occurring in water, if you're in a pool setting, there are going to be various reasons. But again, when in doubt, always call 911. It is their job to field your call. All right, let's transition a little bit now into the actual management of seizures. So the ultimate goal for a person diagnosed with epilepsy is going to be seizure freedom. The next best attainable goal is going to be seizure control. And 70% of people do get very good seizure control on anti-seizure medication. So as you can see on this screen, we have medications in 2 categories. The anti-seizure meds are taken by anyone who has a diagnosis, and they're also known as anti-epileptic drugs. This is what's given on a set schedule, morning and night, and that's probably why you will not have to interfere middle of day. But this is what's going to keep that student in very good control. Seizure rescue medications, on the other hand, are given in very specific situations to certain students who have a prescription for that rescue medication. So not everyone who has epilepsy is going to need a rescue medication. And again, you will be following your seizure action plan to look for very specific information. And anytime you're administering any rescue medication, you will be calling 911. So again, 70% of people do have very good luck with medication. However, there are now 30% of people who don't have as good luck with medication in controlling their seizures. So they do have other options available to them. And one of the ones that I wanted to mention that is becoming more and more prevalent is Epidiolex. So this is a synthetic form of CBD. It is FDA approved and it goes under the brand name of Epidiolex. It is a prescription. It is not one size fits all. So not even 2 people with the same diagnosis will have this. But what you need to know here is that according to Ashley's Law, which was passed also in 2018 when Epidiolex was passed, it allows students to bring their CBD oil to school and have a nurse administer that medication. And this is all indicated in your separate ISB training to administer medical cannabis. But I wanted to just put this out there that some students do have Epidiolex. Now we're going to talk a little bit about rescue medication. So in general, the umbrella of rescue medication is all covered under the Good Samaritan Act of Illinois. And that's great news. So anything that you try to do, whether it's an EpiPen or any of the 3 that I'm going to discuss here, you are covered under the Good Samaritan Act. And again, I wanted to stress again that not every student who has seizures is going to have one of these rescue medications. And rescue medications are given so that we can avoid that 5-minute medical emergency mark. So there are 3 FDA-approved rescue medications I'm going to discuss. And the first is Nasolam. So the first 2 are nasal sprays. So this is much like Flonase, as you can see in the screen, very simple to administer. This is FDA approved for kids 12 and older. And a lot of kids are actually now able to self-carry, which is great. So if they have a feeling, an aura that a seizure is coming, they are able to help themselves and get themselves to a calm spot. So this is Nasolam. Valtoco is a second nasal spray. This is FDA approved for kids 6 and older, very similar to the first one. A 6-year-old probably is not going to be self-carrying, so it is likely that a DCA would get involved in administering this. Both this and the previous one are one-time use, so this is not something that can be used again and again. Each blister pack is a single dose, so once it's used, it needs to be discarded, and then obviously the parent will replenish their stock. And the third approved medication is actually the oldest one on the market, Until 2019, this was the only thing that was available. So the gold standard of stopping a seizure from heading into that post 5-minute mark would be to administer an IV of Valium, which obviously you and I don't have access to. So the next best thing is going to be a gel form of Valium, and the quickest way to get that into the system is through the rectum. So Diastat is administered rectally. Again, the focus here is that you're trying to prevent that seizure from going into the 5-minute mark. As you can see on the next screen, it takes 15 seconds to administer. It's a single use as well. Anyone who is trained to administer Diastat can administer at any time. There is a lot more information at diastat.com at the following video.
So another form of rescue therapy is called rectal diazepam gel. So diazepam or Valium is a medication that's used to stop seizures. It can be very quickly absorbed when given rectally. So a number of years ago, we had this developed by a company into the product called Diastat or Diastat AccuDial. So in this format, it's very easy to use, can be rapidly absorbed, and actually starts working, in the brain within 15 minutes. The good news is that the diazepam also lasts a long time in the system, so that if a person tends to have repeated seizures, it can act on to help stop those seizures over a number of hours. Now, when you get a prescription for this, it's usually prescribed for a person who tends to have cluster seizures. And by that, I mean they might have periods of seizures that, if that could be recognizable, that if they've had 2 or 3 seizures and that that they might go on to have more unless they give a medication or a therapy to stop it. Or that if their seizures are progressing from a simple partial seizure or kind of an aura to one with a impaired consciousness. So the first thing you want to know about is the person who's prescribing it needs to be clear about when they want it given. Some people might have a tendency for seizures that last longer than their typical ones. So the doctor may recommend that if you have a certain kind of seizure that lasts a certain amount of time, that also be given. But the important takeaway message is that you have information from the prescribing provider about when to give it, how much to give, whether you give 1 dose or whether you give 2, and if you can do a second one, how long do you wait before you give it. Now, when you pick the product up from the pharmacy, you'll have a package with 2 prepackaged syringes. You're also going to have an instruction sheet which actually tells you the steps, and your doctor or nurse can write down information of when to give it. It also will give you pictures on how to give it. These can also be found right at the website for Diastat, and we have copies also on epilepsy.com. So a few things to point out: that the pharmacist needs to set the dose for each syringe. And so you'll see a little window here where the dose is kind of what we call dialed in or prescribed, and that can be done only by the pharmacist. So when you pick it up, you check with your prescription, what your doctor told you, you check the window, make sure that it's the right dose. You also want to look and see, is there a color-coded a bar here, in this case it's a green bar, that says ready. If you don't see that, you take it back to your pharmacy to make sure that the dose, the syringe, is okay to use. Also, you keep in mind that this is a one-time use medication, and you would follow the instructions on the packages of when and how to dispose it after you've used. So let's say this is Susan's come across her child who's having a seizure, and so she's going to demonstrate for us what she would do in giving the medication.
Okay, I would have checked this already, so I see the green bar. I would have my child on their side, and in this case it would be easier if they're facing me. This is a little stiffer than my child. And Holding the Diastat, I check the dose, I see the green bar, I'm good to go. I remove the cap, making sure the safety pin is in the middle and has come out smoothly with it. I would rip open the lubrication pack that's also included with the medication. I would dip the tip in the pack, get a lot of lubricant on it. I would just pull the pants down enough just so that I have access to the anus, and then insert the medication very slowly. Press the plunger with a count of 1, 2, 3. Hold the medication there for a slow count of 1, 2, 3. Remove the syringe, holding the buttocks closed. 1, 2, 3. And then pull the clothes back into place.
Okay, so it's as simple as doing that.
It is simple.
Right?
It is simple.
And as I watched that, you kept the person's privacy pretty well.
Absolutely.
If the person's in a chair, can you do that as well?
I would remove them from the chair and bring them onto the floor to do that. Again, turning them on their side towards me so that I could manipulate them.
Okay, so a person that's having a seizure, you certainly can do it by yourself if the person's not too large. If it's a larger person, you could easily call for help for someone to
Absolutely
help you with that.
And we've also used people as barricades, asking the onlookers to just turn their backs and be a wall around us. We've also used that strategy as well. It gives them something to do. You know, particularly in a school setting, if you ask the adults in the room to just be a wall. It depends. It depends on the situation you're in. Yeah. Certainly at home, but it can be done by one person, and if you have someone to help you, certainly use them. Use them as necessary, whether it's for privacy reasons or to help you, because obviously this is a still doll. If it's someone convulsing, you may want them to help you hold them on their side while you manipulate the syringe and remove the clothing. But you don't have to remove it completely, as you saw.
So when you use this rectal diazepam gel or Diastat, because it is available in generic or in the brand, it's as easy as doing that. And then you're going to follow your typical monitoring the person after the seizure. You're going to continue to watch and see if the seizure's subsiding. If the seizure's not subsiding over the period of time that your doctor or nurse has recommended, you give the second dose if that's prescribed. As the seizure is ending, you then let the person rest. But as we talked about before, you follow the steps in watching someone during the recovery period. If you're at home, you follow the steps of what you've decided upon with your team about how to monitor your child. People can go back to their day-to-day activity many times. Sometimes people are sleepy and might need to have a nap. If you're doing this with a child, they should talk to their school nurse to find out if there's any special policies. And sometimes, depending upon where you are, they might require that you call 911 or call for emergency help as backup. It's not necessary unless the rectal diazepam gel doesn't work or the person has continued seizures. So this was an example of some of the rescue therapies or interventions that can be used now to help people who are having seizures or are having periods of increased seizures. As I mentioned a little bit ago, we also have other ones in development, and it's going to be exciting to see what comes down the road in the next few years. I hope you found this information. Susan, I certainly found this helpful, actually seeing it as you're demonstrating it right here. I want people to the take-home message here is that seizure first aid doesn't have to be scary. There are resources, there are help available for you. Go to epilepsy.com, go to their Get Help section where you can read more about seizure first aid or using rescue therapies. Also use your Epilepsy Foundation affiliate. They can also give you some additional help and resources, or you can have them help train school personnel or people at work or whatever setting that you're in. So remember the Epilepsy Foundation and resource, and I hope this helps you in managing seizures well.
There are a few other palliative options that I wanted to share, things that you might see in your students. Again, these are things that are used when medication alone is not working. So the first is a vagus nerve stimulator. So that is if you see that man in the middle of the screen, he has a generator that's surgically implanted right under his chest, and it's connected to the vagus nerve. And its job is to send pulses to the brain all day, every day at a programmed rate, such as on for 30 seconds, maybe off for 2 minutes, off for 5, etc. So the only way you would even know that a student had a VNS installed is because when it's on, you could hear that person's voice get a little bit hoarse. But there are some times that you might actually need to trigger that VNS if the seizure started and the magnet happened to be off. So you would, and the generator happened to be off. So you would grab the magnet and tap or swipe it on the generator, and you could actually turn it on. And if the seizure already started, you would reduce the severity of it or slow it down, or maybe you would even be able to abort it entirely. So this is FDA approved for kids 12 and older. So that's great news. The RNS is actually FDA approved for kids 18 and older, but there are some kids who are being seen locally in one of the epilepsy centers that are actually under 18, and they are in a trial to get this done. So there's not really much to share here because it's not fully FDA approved for kids under 18 yet. But I wanted to also mention below that laser ablation and epilepsy surgery is now really a great option. It can definitely help to reset some of the neural networks and to rewire the brain to stop producing those seizures. So that is another available option to a lot of our families. And finally, and this is something that maybe you personally have experience with or that you might see in the classroom, is the ketogenic diet. This is used for very difficult to treat seizures. And essentially, it strips the diet from all sugar and carbs. And it's a high fat, high protein diet. The body stays in a state of ketosis all day, and the brain is running on fat as fuel instead of carbohydrates. So these are things that you might see as well.